I grew up in southern Minnesota, in a town of about 30,000. We spent about 9 months of the year during the school year in town, and then had the opportunity to live at a rural lake cabin over the summers, and it was a wonderful way to grow up. I work as a comprehensive ophthalmologist. My primary focus in terms of surgical practice is cataract surgery. I was not planning to be an ophthalmologist when I was younger, but my father was an ophthalmologist, so probably had some influence in that regard. Went through my undergraduate training in Minnesota and then off to Northwestern University in Chicago for medical school, and then back to Minneapolis for my internship at Hennepin County Medical Center and did my residency at the University of Minnesota. My path to Wolfe Eye Clinic is probably a little unusual. I had been in practice for about 15 years, and we had a somewhat unexpected offer made to us to go to Indonesia to help a mission hospital develop a new eye program. And I had been involved with international ophthalmology for many years on a part-time basis, but this was a new challenge to be there full-time. So we lived in Indonesia for 5 years to help train up a team there, and we were blessed with success. And you see a lot of advanced pathology in these situations and don't always have the tools that we would have here. And so it forces you to learn new techniques and innovative ways of handling challenging situations. And those techniques have helped me in my practice here, and I routinely use them. When we came back from Indonesia, we were looking for a practice in the United States again to join, and looking for a leading group that was well-run and well-respected. And when the opportunity with Wolfe Eye Clinic came along, it really was the right fit for us. I have some ties to Iowa from my childhood because we would spend our Thanksgivings in Algona, Iowa, with my uncle who was an optometrist. And he's now long retired in his 90s, but when he heard I was joining Wolfe Eye Clinic, he was very excited because he'd worked with them even during his career. It's a well-run group with top-notch providers and staff. It has a stellar reputation for excellence. Central Iowa is, really all of Iowa, is blessed to have Wolfe Eye Clinic here, and high-quality care really comes to many communities that otherwise might not have it. Ophthalmology is a wonderful field in the sense that we can help many patients, and so there are a lot of stories. One comes to mind of a man in Indonesia who had been blind for about 21 years. Actually, he ended up having normal vision in both eyes after his surgery. First, he looked over at his wife. They had been married for 21 years, and he was blind when they were married. He looked over and first said, "You're beautiful." And it was really touching. And then he said, "I'm going home to see my son for the first time," who was 20 years old. So
that's incredible. How rewarding is that to work in a field where you can impact someone's life for the better like that?
It never gets old.